Good morning, this is YouTube Medical University. Today I want to explain the risks of stomach cancer that you absolutely shouldn't overlook and the important early symptoms to watch for in order to detect it early. What I'm going to talk about today is very important for the early detection and early treatment of stomach cancer. By listening to this video until the end, I believe you can greatly reduce the risk of losing your life to stomach cancer. If any of the risks I explain apply to you, please take appropriate measures. If you have any of the early symptoms, please make sure to consider visiting a hospital. Everyone, I have a question for you. Among all cancer-related deaths, where does stomach cancer rank among cancer deaths? The answer is second. For men, stomach cancer is the second leading cause of cancer death. For women, it is the fourth leading cause. As I will explain later, by eliminating a certain risk, the mortality rate of stomach cancer has been decreasing year by year. However, stomach cancer still ranks second among cancer deaths. If stomach cancer can be detected early, the 5-year survival rate for early-stage stomach cancer is very high, at 95%. However, if stomach cancer is found at an advanced stage, especially if it has spread to the lymph nodes throughout the body, the 5-year survival rate is about 10%. Because the risk varies greatly depending on when it's found, detecting stomach cancer early at the first symptoms is crucial to prevent it from becoming serious. Even earlier, during the pre-disease stage, I think it's important to reduce risk factors before developing the illness. So this time, in order to prevent losing your life to stomach cancer and to be able to catch the early symptoms, I want to clearly explain the types of risks and tests from a practicing doctor's perspective, making these complex topics easier to understand. Well, there are several stomach cancer tests, such as ABC screening, endoscopy, and barium swallow, but which is best? Are these tests even necessary? Besides smoking, what other risk factors exist for stomach cancer? I've had some indigestion. Could that be an early symptom? If you're concerned, watch until the end. YouTube has many videos about stomach cancer. There are many videos that explain the symptoms in detail, but not as many that cover risk factors, testing methods, treatments, or things that might help prevent stomach cancer. There don't seem to be many videos that cover information about foods or other such topics, so this time the video might be a bit long, but I will do my best to explain things clearly and responsibly share accurate information. Please listen until the end. At the end of this video, I'll mention foods recently suggested to help prevent stomach cancer, so stay tuned. I work at a community hospital in Hokkaido, seeing outpatients, making home visits, and performing weekly endoscopies and barium swallow tests. Based on these experiences, I will be sharing accurate information in accordance with the guidelines, so I would be happy if you could hit the subscribe button so you don't miss any new videos. Now then, for today's agenda, let's start by reviewing the anatomy and function of the stomach. Second, I'll explain the top 5 risks for stomach cancer and what kinds of things can increase your risk. And third, something many of you are probably curious about, the top 5 early symptoms of stomach cancer. I'll explain what symptoms should make you suspect stomach cancer. Fourth, this is something that hasn't really been covered in other videos. ABC screening, endoscopy, or barium test. Which should you take? I'll outline each test's pros and cons. Personally, I would choose that one. Most doctors prefer a specific test for stomach cancer screening. I'll also briefly cover stomach cancer treatments and ways to eliminate Helicobacter pylori. And as a final bonus, I'll introduce 3 foods that are recently said to help prevent stomach cancer, so please stay with me until the end. Now, let's get started. First, let's review the anatomy of the stomach, okay? Here it is. You don't need to remember all the details. The stomach is left of your body's center. Food passes through the esophagus into the stomach, then moves to the duodenum, small intestine, and large intestine. The stomach has upper, middle, and lower parts. The area between the esophagus and stomach is the cardia, and the stomach's exit is the pylorus. Do you know the main characteristic of the stomach? That's gastric acid, right? It's said that gastric acid is actually more acidic than a lemon. It's hydrochloric acid. So if gastric acid flows back up, it's called gastroesophageal reflux disease. And the esophagus, the gastric acid can irritate the esophagus and cause heartburn. This gastric acid mainly helps break down the proteins we eat. And do you know how much gastric acid is produced in your body in a day? Actually, it's said that about 2 liters are produced every day. Because of this gastric acid, even if we eat various foods by mouth, they are digested in the stomach. Also, the stomach lining is thick and rough, which helps break down food into smaller pieces. Even if we accidentally ingest bacteria attached to our food, in most cases, this gastric acid kills the germs. However, there is one particular germ that lives comfortably in this gastric acid. Do you know what it is? It's Helicobacter pylori. Yes, this is an image of Helicobacter pylori. The yellow part is the gastric acid. It's acidic, but you can see this blue liquid around the Helicobacter pylori, right? This is actually ammonia. This Helicobacter pylori produces ammonia, and since ammonia is actually alkaline, by surrounding itself with alkaline ammonia, it protects itself from gastric acid. That's why Helicobacter pylori is the only one that survived in gastric acid and became dominant. And I'll explain this in more detail later, but this Helicobacter pylori is actually the biggest risk factor for stomach cancer and is something that should be eradicated, so I'll explain that in detail after this. So next I'll talk about the top 5 risks for stomach cancer and briefly explain what characteristics people who are more likely to get stomach cancer tend to have. Top 5 stomach cancer risks. Here's the first. It's salt. Salt is actually a risk factor for stomach cancer as well. I think everyone knows that salt increases the risk of high blood pressure, but people who consume a lot of salt are also relatively more likely to get stomach cancer. Data shows the risk is higher. Still, even when told to cut back on salt, changing eating habits isn't easy. In my clinic, I always suggest using spicy or sour flavors instead of salt in those situations. I suggest using vinegar or enjoying your meals by using a variety of flavors. So, you can season your food with vinegar-based dressings or use spices like those in curry, and for people who like spicy food, things like chili peppers. By seasoning with those kinds of things, you can relatively lower the salt content, and when you're cooking, you tend to want to add soy sauce, right? But if you do that, then gradually, soy sauce consumption will increase. However, adding soy sauce or salt just before eating and seasoning at the table can help lower your salt intake. Now, let's discuss the second of the 5 stomach cancer risk factors. It's obesity. So what is obesity? People with a BMI of 25 or higher are said to have a higher risk of stomach cancer. BMI is something you can easily calculate. Divide your weight by your height twice. For example, if someone weighs 70 kilograms and is 170 centimeters tall, be sure to convert centimeters to meters. In this case, the BMI would be 24.22. So this person is just on the edge, slightly overweight, but not obese enough to increase the risk of stomach cancer. Now, the third of the top 5 stomach cancer risks is this: a family history of stomach cancer. Just having a family member with stomach cancer increases your risk. This is true for many types of cancer. If a family member has pancreatic cancer, your risk is higher too. Now, the fourth of the top 5 stomach cancer risks is this: it's tobacco. Tobacco, in fact, is known to be a risk factor for most cancers. According to some highly reliable data, 18% of stomach cancer patients, it's said that about 20% of cases are related to tobacco use. And when comparing the risk of stomach cancer between non-smokers and smokers, it's reported that smokers have a 1.53 times higher risk. Hearing things like this doesn't make quitting smoking easy, does it? If you're interested in quitting, many general hospitals have smoking cessation clinics. Look them up online and consider visiting one. 5 stomach cancer risks. The last is Helicobacter pylori, the biggest and most dangerous risk factor, as I mentioned earlier in relation to stomach cancer. I've mentioned that the mortality rate has been decreasing year by year, and it's said that this is because eradicating Helicobacter pylori has become more common. On the flip side, I think this shows just how closely Helicobacter pylori is related to the risk of stomach cancer. Even when I do endoscopies in my daily practice, there's not a day that goes by where I don't talk to patients about Helicobacter pylori. That's how common it is. There are that many people infected with Helicobacter pylori, and what you need to be careful about here is that Helicobacter pylori isn't just common among the elderly. There are also many young people who are infected with it. Now, look at this endoscopic image of the stomach. The left side is pink with folds and many fine lines. Its surface is smooth, indicating it is not infected with Helicobacter pylori. And how about the stomach on the right? You can see that the surface mucosa is red and inflamed. If you look closely, you'll also notice that the folds are gone. You might also see some white areas within the red parts. This is a sign that the mucosa has become thin and atrophic due to Helicobacter pylori. This is exactly what a stomach infected with Helicobacter pylori looks like. The left image shows an 80-year-old stomach, while the right shows a 40-year-old stomach infected with Helicobacter pylori. Whether or not you're infected with Helicobacter pylori, the condition of your stomach can change this much regardless of age. By eradicating Helicobacter pylori, they say your risk of stomach cancer drops immediately. And the treatment for Helicobacter pylori is just taking medicine for 1 week. In most cases, just taking antibiotics for a week is enough. So I encourage you to actively consider getting rid of this Helicobacter pylori. I wasn't infected with Helicobacter pylori, but if I found out I was infected, I would definitely start the eradication therapy for Helicobacter pylori right away. That's how much I recommend this treatment. Now then, I think this is something everyone is curious about. 5 early symptoms of stomach cancer. So are there any early symptoms of stomach cancer? And if there are, what kind of symptoms are they? I'll explain that now. These are symptoms you should never ignore. 5 stomach cancer symptoms. Here's the first. This is loss of appetite and nausea. When a foreign object like stomach cancer appears in the stomach, food doesn't get digested properly, so your appetite decreases. Also, when food can't move on to the duodenum and small intestine, it can cause nausea. I'll explain more about this later, but actually, stomach cancer tends to bleed easily. If there's slow bleeding from the stomach, it can lead to anemia. When you become anemic, you feel tired. No matter what you do, even eating becomes exhausting, and you might not be able to eat at all. That's the kind of condition you can end up in. You should never ignore these symptoms. The second of the 5 early symptoms of stomach cancer is this: your stool becomes black. Some of you might be thinking, wait, if stomach cancer causes bleeding in the stomach, wouldn't the stool turn red? That's actually a very good thought. But let me explain this using a diagram. Okay, let's say cancer develops in the stomach. This blue part represents the cancer, and as for cancer itself, it keeps growing inside your body, creating new blood vessels, these red areas. So many blood vessels form in the stomach to help it grow larger. Because a lot of blood vessels gather around, stomach cancer tends to bleed easily. When bleeding occurs from stomach cancer, you may see red blood, but this red blood actually reacts with stomach acid and oxidizes, turning black. So if you vomit blood that has bled in the stomach, it might still appear red, but if it has already reacted with stomach acid, it could be black. At the very least, when the blood passes through and comes out as stool, bleeding from the stomach will turn black. So when you have stool that is as black as ink, really as dark as this stethoscope, like India ink, you need to consider the possibility of bleeding from the stomach. If it's completely black, you'll likely notice something's wrong and go to the hospital. Even slightly darker stool can be an early sign of stomach cancer, as a small amount of bleeding can darken your stool. Another key factor is how long the black stool lasts. If your stool is temporarily black, it could be from gastritis or a stomach ulcer, which can cause black stool. But if it stays dark for months, in those cases, since cancer doesn't just go away on its own, if the black stool continues for a long time, it could be an early symptom of stomach cancer. Or review the following, though it may be a challenging topic. Here are early stomach cancer symptoms you shouldn't ignore. Third, upper abdominal pain or discomfort. This upper abdominal pain refers to the area above the belly, called the upper abdomen, which is generally above the navel. It's discomfort or pain around the pit of the stomach. If there's obvious pain, that can be considered an early symptom, but often it's just a vague sense of discomfort that is actually an early symptom. This stomach discomfort can also happen with gastritis or ulcers. Having this doesn't always mean you have stomach cancer, and not having it doesn't mean you don't. Still, people with stomach cancer are more likely to have it. There is data showing that among the symptoms, upper abdominal pain and discomfort were the most common. So in that sense, upper abdominal pain and discomfort are important symptoms to pay attention to. As for why this happens, to be honest, when the cancer is still small and in its early stages, upper abdominal pain usually doesn't occur. However, as the cancer gradually progresses, the stomach becomes harder and gets compressed. Or as the cancer invades and spreads to the outside of the stomach, it can touch the nerves that run there. This causes clear abdominal pain. By the time this happens, the cancer has already advanced, so it's rare to find stomach cancer just from upper abdominal pain. I've rarely seen such cases myself. 5 early symptoms of stomach cancer you shouldn't ignore. The 5th seems unrelated. What do I mean by an unrelated symptom? If you're wondering what that means, actually, for more than half of the people diagnosed with stomach cancer, the reason it was found was through detailed examinations or by chance. I think this is surprising. In my experience as well, more than half of the cases where I discover stomach cancer are when people come in for a stomach cancer screening, or when they're visiting the hospital for another illness like diabetes or high blood pressure, and they just happen to get a gastroscopy, which then reveals stomach cancer. More than half of the cases have no symptoms at all. This is something I really want to emphasize. There are a lot of videos introducing early symptoms for early detection, but this is the reality. In other words, stomach cancer has a very high survival rate if it's found early, but it's a type of cancer that's difficult to detect early. So in the next chapter, I'd like to talk about what kind of tests can help us detect stomach cancer early. Next, I'd like to talk about the tests you absolutely should take to detect stomach cancer early. There are mainly 3 types of tests for stomach cancer: gastroscopy, barium swallow test, and the ABC screening. Among these, gastroscopy and the barium swallow test are considered organized cancer screenings, which means you can get them at a lower cost with public funding from your local municipality. The ABC screening is not included in this category. Let me just mention something important as a side note. These are the organized screenings conducted by local municipalities. Local municipalities encourage citizens to take these tests by offering public funding and waiving fees. They're the organized screenings listed on the left. These are the tests for which there is clear data showing that taking them significantly lowers mortality rates, and the benefits clearly outweigh any disadvantages, so please make sure to remember these. Stomach cancer screening uses endoscopies and barium swallow tests. Lung cancer screening includes chest x-rays and sputum cytology. Colorectal cancer uses stool tests. Cervical cancer uses pap smears. And breast cancer uses mammography. Also, tests like chest CT scans on the right could detect lung cancer, right? And brain MRIs might also detect brain tumors, right? However, these are not tests that are covered by public funds. They are done in comprehensive medical checkups or at general hospitals, but they are not promoted by local governments. The reason these are optional is because there is no clear data showing that undergoing these tests actually lowers mortality rates, because it is believed that the disadvantages may outweigh the benefits. For example, what are the disadvantages? These tests might detect a tumor that causes unnecessary anxiety or extra costs for more tests. Even if something is found, it may not be harmful, and there's no data showing treatment lowers mortality. Also, the pancreas is known as a silent organ in pancreatic cancer. It's quite difficult to detect it early, and by the time it's found, it's often already too late. That's the case with pancreatic cancer. So, when it comes to pancreatic cancer screening, the reason why we don't routinely do abdominal ultrasounds or CT scans is because even if we find it and treat it, it's believed that we can't lower the mortality rate. On the other hand, for prostate cancer screening, we use a marker called PSA, but there are mixed opinions about this test as well. I think it's okay for people who are at risk to get tested, but if we do it for all men, the PSA value can also go up due to benign prostatic hyperplasia, which most men develop as they age. So just because you measure PSA doesn't necessarily mean you have prostate cancer. And actually, prostate cancer has a high 5-year survival rate. Depending on the type, there are some prostate cancers that don't really cause problems throughout a person's life. So considering all these aspects, at the very least, it's better to have these organized cancer screenings done. That's why I always ask my patients to at least get these cancer screenings during regular visits. However, even aside from these cancer screenings, as long as each person fully understands the benefits and drawbacks of each test, I believe there's no right or wrong answer when it comes to whether you choose to take a test or not. What's important is to get a thorough explanation from your doctor and then decide whether to take the test. It's important to weigh the benefits and drawbacks for yourself and decide, maybe I'll take this test, or maybe I don't need to take this one. So please make sure to look into it on your own as well. Now, getting back to the topic, which test should you choose? The gastroscopy or the barium swallow? I'd like to explain the advantages and disadvantages of each. By the way, to give you the conclusion first, most doctors tend to choose the gastroscopy over the barium swallow. I'll explain the reasons for that now. Please take a look at this diagram. The text is a bit small, but I'll explain it verbally. The advantage of the gastroscopy is that you can directly observe the inside of the stomach with a camera. Gastroscopy is nearly 1,000 times more effective at detecting issues than the barium test, allowing it to find cancers the barium test might miss. Another benefit of gastroscopy is, also, though an annual barium test is recommended, patients with no risk factors are advised to have a gastroscopy every 2 to 3 years. Gastroscopy is often more convenient in terms of frequency. However, I've had some traumatic experiences myself, highlighting its disadvantages. There's the gag reflex, which can make you feel nauseous or cause throat pain, and after the procedure, you may experience a lot of gas. These disadvantages are real. With new gastroscopy techniques, options like transnasal gastroscopy are less uncomfortable. Sedatives can also let you sleep during the procedure, so you wake up when it's done. Some hospitals offer gastroscopy with alternative methods. If you struggled with traditional oral gastroscopy, consider sedation or transnasal options. So, what are the advantages of barium? The main benefit of a barium test is that it doesn't have the discomfort associated with gastroscopy, right? Also, while a gastroscopy usually takes about 5 to 10 minutes, a barium test using barium, you drink a substance that shows up easily on x-rays and a foaming agent that expands your stomach, then you lie down on the x-ray table and they take about 10 images from various angles. Once the x-ray images are taken, the test is done. It usually finishes in 3 to 5 minutes, so it ends quickly. Now, regarding the disadvantages of barium, drinking barium is tough, isn't it? People who struggle with it probably dislike barium, and if you can't suppress burps, you'll end up burping during the test. Also, you have to drink this foaming agent that expands your stomach, so it's a bit of a hassle and can actually take more time than you expect. And the biggest disadvantage of barium is that if something abnormal is found with the barium, ultimately you still need a gastroscopy. I think this is the biggest disadvantage. If you get a barium test for your stomach and it looks like there might be a malignant polyp, or if you have something called atrophic gastritis and it seems like you might be infected with H. pylori, you can't go straight to eradicating the H. pylori just from the barium test. You need a gastroscopy to be diagnosed with atrophic gastritis and prove H. pylori infection before insurance covers eradication therapy. Since you'll need a gastroscopy after any abnormal barium test, it's worth considering getting one every 2 or 3 years, even though it's tough. So finally, what kind of test is the ABC screening, which isn't included in the organized screening programs? This is a test that's generally done during regular hospital checkups or comprehensive medical exams. I also sometimes order this test, and personally, I think it's fine for people who want to do the ABC screening as long as the contents of the test are explained to them. What this ABC screening is that just by taking a blood sample, it's said you can determine whether you're infected with Helicobacter pylori and also the severity of gastritis caused by the bacteria. Please take a look at this diagram. The H. pylori antibody refers to the value of antibodies in the blood against Helicobacter pylori. If this is present, it means you are likely infected with H. pylori. And as for pepsinogen, pepsin is a digestive enzyme in the stomach, and ogen means precursor or origin. In other words, it serves as an indicator of the stomach's ability to produce digestive enzymes. When you get infected with H. pylori and your stomach becomes atrophied, the stomach lining gets thinner and thinner so it can't produce digestive enzymes and the pepsinogen level decreases. This is called a positive pepsinogen test, so if the pepsinogen section is marked as positive, it means the secretion of pepsinogen is decreasing. The lower the pepsinogen value, the more severe the person's gastritis is likely to be. In other words, as you move from A to D on the left side, the condition becomes more severe. Take a closer look. Section D says H. pylori antibody negative, right? Do you know why? The reason is, the end result of a stomach that has been infected with H. pylori is that it becomes such a harsh environment that even H. pylori itself can no longer survive there. H. pylori can survive in the acidic environment of the stomach, but because of H. pylori, when gastritis thins the stomach lining, the stomach stops producing acid, creating an environment where even H. pylori can't survive. H. pylori antibodies are negative. It's not something to celebrate. In fact, it means your stomach has already deteriorated that much. So why do I recommend this test? There are actually quite a few advantages to this test. There are 4 main benefits. First, you can easily find out with a blood test. No need for an endoscopy or barium. This tells you if you're infected with H. pylori. And you can take this test regardless of your age. Generally, endoscopy is recommended after you turn 50, but with this ABC screening, anyone who is concerned can take it at any age. By the way, it's recommended for people 40 and older. And the third advantage is that if this test shows your stomach is healthy, you know there's no need to rush into getting an endoscopy. Endoscopy is tough, so it's best to avoid it if possible. If your ABC screening shows a healthy stomach, you don't need to check for Helicobacter pylori right away. I don't think it's necessary, so treat it as a guideline. The fourth advantage, since it's a screening, you'll pay out of pocket, but for something you pay for entirely yourself. This ABC screening only requires a blood test, so the cost burden is significantly lower. It's affordable and simple, and since it can help decide if you need a gastroscopy, I think people who want to can go ahead and get this ABC screening. Alright, just 2 chapters left. I'll briefly explain available stomach cancer treatments. Since this is a specialized field, I'll give a quick overview. There are 2 types, early stage and advanced stomach cancer. Alright, it might be a little hard to see, but the left side here shows early stage cancer, and the right side shows advanced cancer. The difference between them is the depth. Here is the gastric mucosa, which is the surface, the inside lining of the stomach. Food touches the mucosal layer. Below that is the muscle layer, and the outermost layer is called the serosa. Early stage cancer, to put it simply without worrying about being misunderstood, is a shallow cancer that hasn't reached the muscle layer. And in contrast, advanced cancer refers to cancer that has progressed deeper than this muscle layer, below the muscle layer. The treatment methods are very different for each. If it's early stage cancer, in many cases it can be removed by cutting it out with an endoscope like this. But if it becomes advanced cancer, surgery may be necessary, and it may have also spread to the surrounding lymph nodes. In these cases, surgery may be followed by chemotherapy, which can involve anti-cancer drugs, targeted therapies, and immune checkpoint inhibitors. Chemotherapy is often needed, and if a cure isn't possible, treatment may switch to palliative care. That's why early detection is crucial. It's clear how crucial early detection of stomach cancer is, as it determines whether treatment requires just an endoscope or more intensive options like surgery or chemotherapy. As for how to diagnose and treat Helicobacter pylori, the diagnosis is simple. You can check the amount of H. pylori antibodies in the blood with the earlier ABC screening, or you can do a stool test to see if H. pylori antigens are present. And then if it looks like there might be H. pylori from the endoscopy, and the blood or stool test also suggest H. pylori, then eradication treatment will begin. The eradication treatment involves 3 types of medication. The treatment is simply to take 2 antibiotics and 1 stomach medicine, a total of 3 medications for 1 week. With this, more than 90% of people successfully eradicate the bacteria. By the way, to check if the eradication was successful, there's a test called the urea breath test, where you blow into a bag and it can tell if the H. pylori bacteria are gone. I really strongly recommend eradicating H. pylori as a risk factor for stomach cancer before stomach cancer develops. Alright, so finally, thank you for waiting. From here on, please relax and just listen. We are starting to understand which foods might help prevent stomach cancer. I'd like to introduce 3 of these foods while showing you some data, foods that lower the risk of H. pylori. Top 3 choices. The first and second are fruits and vegetables. Multiple studies from Europe, Asia, and North America have reported this, collecting data from all kinds of people. When comparing the group that ate the most fruits and vegetables with the group that ate the least fruits and vegetables had the highest risk of stomach cancer. Compared to the group that ate the least, the group that ate the most had a 30 to 40% lower risk of stomach cancer. This is an amazing result, isn't it? There are also studies suggesting that not eating a lot of citrus fruits might reduce the risk of cancer. However, there is also data showing that fruits are beneficial. It might be better to consume fruits other than citrus fruits. And there are more reliable studies called meta-analyses, which combine various studies and analyze them together, and the data from those show that people who eat a lot of fruit do have a lower risk of stomach cancer. On the other hand, the results showed that it's unclear whether people who eat a lot of vegetables have a lower risk of stomach cancer. So taking all these results into account, the food I would recommend is fruit other than citrus fruits. And I'll say this first. The third food that reduces the risk of stomach cancer was dietary fiber. Some of you might think dietary fiber isn't a food, is it? But it's true that vegetables and fruits are rich in dietary fiber. So what kind of data is there about dietary fiber? This is also from a meta-analysis, which is a combination of various studies that have been collected and further analyzed. When comparing the group that consumed the most dietary fiber with the group that consumed the least, it is said that the group consuming more fiber had a 42% lower risk. It's 42%. You can see that the risk has decreased quite a lot. So when you feel a little hungry, if you avoid salty or high-calorie foods, you can lower your risk of stomach cancer. And there's data showing that if you replace those with fruit, your risk of stomach cancer decreases even further. If you're a bit hungry, try eating fresh fruit instead of salty foods. Please make this a habit. How was it? The explanation about the stomach's anatomy and function was a bit lengthy this time. We also talked about the risks of stomach cancer, its early symptoms, treatments for stomach cancer and Helicobacter pylori, and foods that can lower the risk of stomach cancer. To review, stomach cancer is the second leading cause of cancer deaths. Early detection leads to a high 5-year survival rate, but advanced cases have much higher mortality. And the risk factors for stomach cancer include obesity, high salt intake, smoking, and family history. I talked about Helicobacter pylori. As for the early symptoms, they include loss of appetite, nausea, stomach pain, a feeling of discomfort, and persistent dark-colored stools. Actually, I explained that half of the people with stomach cancer have no symptoms and are diagnosed by chance. For early detection of stomach cancer, important tests include endoscopy, barium swallow, and the ABC screening. The first 2 are included in organized cancer screenings, so the coverage rate varies depending on the municipality, but you can get these tests with public funding, making them relatively affordable. Please review the advantages and disadvantages and decide for yourself which test you want to take. If you don't want either test, please consider the ABC screening. For early stage stomach cancer, treatment may involve endoscopic removal, but for advanced cancer, you might need surgery, sometimes followed by chemotherapy. In some cases, neither is possible. Regarding foods that may lower stomach cancer risk, I talked about vegetables, fruits, and dietary fiber. Especially recommended are fruits other than citrus fruits. Things like kiwi, bananas, strawberries, anything is fine. When you feel a little hungry, eating these instead of salty or obesity-causing foods may greatly lower your stomach cancer risk. So catching early symptoms is not the only important factor. By lowering your risk before you actually get sick, I believe you can extend your healthy lifespan. I will continue to share useful health information that you can use starting tomorrow, so I would be very grateful if you could subscribe to the channel. And if you thought this video was good, I would really appreciate it if you could give it a thumbs up or leave a comment in the comment section. Well then, see you again in the next video.